Hello everyone, this is Dr. a founder of Korea Tooth Bank, which is the world leader of biorecycling of tooth into bone graft material. Today I will introduce the application of Moldable AutoBT Dentin powder fabricated by Korea Tooth Bank for sinus class 3 defect associated with using autogenous lateral cortical plate. Reference background of this presentation is Journal of Heart Tissue Biology, we published in 2015. The treatment plan was to the lateral window opening to elevate sinus membrane and to place the implant during the securing the primary stability, and to do packing up the whole space around the implant with Moldable AutoBT Dentin powder. Lateral cortical plate taken during window opening of sinus was repositioned to the lateral or roof side of the Moldable AutoBT. Then suture without using any conventional membrane. Let's see the operation video. CBCT shows window open side for getting into sinus where there is a thick bicortical bone. During window opening, try as much as possible not to damage the underlying sinus membrane. We had two pieces of bone plate. One is outer sound cortical bone. Second is inner cortical cancellous bone plate. During the removal of bone, the sinus membrane was lacerated. However, fortunately, this rupture did not hinder the membrane elevation. Watch the movement of membrane along with patient breath, and then place the implant engaged in sinus flora and below the elevated sinus membrane. Moldable AutoBT Dentin powder was prepared as round shape for easy handling and packed into sinus around the implant carefully. As you can see, Moldable AutoBT does not move at all. It's very easy to mold, transfer, and packing into sinus because of the collagenous and sticky nature of dentin. See the packing. It's very easy. And finally, the lateral cortical bone was repositioned to the roof and the lateral side of Moldable AutoBT to build up a whole implant housing in sinus cavity. Especially, no additional fixing tool is necessary. To remember, no additional fixing tool is necessary. And then leave the gap at the window opening side to use as drain route of blood from sinus cavity, and suture without any membrane application. Let's get through this case one more time as brief summary. Make indentation the implant site on alveolar bone. Open the lateral window to get into sinus cavity. This is the lateral cortical plate taken after sinus window opening. Sinus membrane was lacerated during opening procedure. Regardless of the ruptures, membrane was elevated to place two implants below. Moldable AutoBT was applied for building up housing around the implant in the sinus. As Moldable AutoBT dentin powder being mixed with patient with own blood, it does not move at all. Two lateral bone plates were repositioned on roof and lateral side of moldable AutoBT dentin powder, respectively. No additional fixing tool is necessary. Leave the gap between the sinus lateral wall and reposition cortical plate for the purpose of using drainage after operation. Suture without any conventional membrane. CBCT images of preoperative window opening site. CBCT image immediate after post-operation. Cortical bone plate keep its position of moldable AutoBT and implant. The blood filled in the sinus cavity after operation goes up to mid-sinus level. However, there was no movement of moldable AutoBT powders. 1 month later, the cortical bone plate and moldable AutoBT dentin powder kept its position in situ, and the blood level was going down to the implant apex level. That seems to be obtained through the gap in window opening. 5 months later, blood disappeared and seemed to form new sinus membrane over implant and moldable AutoBT. The lateral cortical plate is fused on the moldable AutoBT and goes through active bone formation and remodeling. This photo shows a histological examination we published in 2013 and 14. This trephine core showed remained thin alveolar bone at bottom and relatively compact bone formation of a sinus floor in the middle. Still, remodeling with remained dentin particles at top of the core. Each moldable AutoBT particle showed osteoinductive deposit of new bone on dentin surface and osteoconductive open bone formation. As a conclusion, in the case of sinus class defect, where the sinus augmentation can be performed by the window opening technique, moldable AutoBT dentin powder and lateral cortical bone plate can be used successfully. The reasons are: first, moldable AutoBT is sticky enough to handle in sinus cavity as well as osteoinductive and osteoconductive. Second, the cortical bone plate may play the successful membrane role better than the conventional wall without any fixing tool. Third, the gap in opening site is very effective for surgical drainage of sinus. Thank you for your kind attention. This has been Dr. in Korea Tooth Bank, Seoul, Korea.